We're seeing now more in the sports. I know I see more in my practice the female athlete sustaining these injuries. What is your theory, or what does the research say is the reason for this increase?
Well, it's true, okay, and I think it's becoming more evident, as you say in your practice, because more females are not just participating in sports; they're high-level sports. And there are more sports. I mean, recently it's lacrosse, and now we have ice hockey.
Yep.
So beyond, field hockey and soccer and tennis and badminton and basketball and softball. I mean, the female athlete is out there, and there's the same number of female athletes out there as there are males. And the only variation out of all this is football.
Yeah. From a biomechanical standpoint, what is some of the reasons?
Okay, we'll get to that. So now research has gone, why do females have more injuries? And they do. Female soccer players have twice the number of injuries, softball players twice, 3 times, basketball players 4 times. So research has now gone into that, and it's multifactorial. It's a lot of different things, okay? Number one, if you look at the anatomy, let's look at anatomy first, wider pelvis, all right? So a wider pelvis means that the angle of the femurs to the tibia at the knee is increased. Okay, so we have a greater, what we call Q angle, it's quadriceps angle, and what does that do? It causes more torque or twist at the knees. Okay, also anatomically, they've talked about hormones. Women, girls go through their menstrual periods. And a certain time during the menstrual periods, there's an increased estrogens. Increased estrogens cause increased flexibility. So women have more flexibility. Okay, that's just not in their normal tissues, i.e. the ligaments and tendons. They'll have increased flexibility or give in the muscles themselves. So there's more give there. Female athletes are weaker than males. I mean, it's just they just cannot build up the strength that a male can. Why? What makes muscle? Androgens. That's male hormones. Males have more androgens than females. The female ACL is smaller. The cross-sectional area is smaller. Therefore, it is weaker. And some of the female athletes are getting fairly good size. They're the same size as male athletes. The notch, where the anterior cruciate ligament rests inside the knee for a female, is smaller. Therefore, with certain twists, that notch can impinge or become, can be pressing on the anterior cruciate ligament. And anything, if you think about it, if you want to break something, if you hit it in the vulnerable area with the right angle, you can start the process of tearing or breaking. Also, we're getting things. Research has gone into now, again, looking at the female athlete. The female athlete, Lily, runs, jumps, and does things differently than the male athlete. They have a tendency to keep their knees straighter. Okay? Their hips are therefore straighter, and their ankles are therefore not as flexed. So they're a little bit more upright. They find that causes more problems with function. Okay?
Is that primarily when they're landing and
when
jumping?
They're landing, or even when they're trying to, change direction quickly.
Okay.
They don't squat down or get down. And again, a lot of athletes, when they're going to change direction, they're flexed more than 90 degrees. Okay? The female reaction to sudden, stress on the knee is slower than a male's by about a millisecond. So their muscles do not begin to function as fast as a male's. Also, the hamstrings are percentage-wise weaker than the quadriceps muscles. So the quadriceps, therefore, are stronger than the hamstrings, and yet the hamstrings are the ones that hold the tibia back and support the anterior cruciate ligament.
So it is a very complex process, and there's a lot of factors, as you said, multifactorial.
A lot of factors.
When it comes to ACL injuries. When we come back after the break, we're going to hear more from Dr. Bade as to what you do once the injury does occur and what the prognosis is for recovery to your prior level of